And thank you for staying with us. Approximately 40,000 individuals are diagnosed with Bell's palsy in the United States each year. However, many individuals are simply not aware of the condition. So you got to ask the question, what are some of the possible symptoms? What causes the condition and how is it diagnosed? Well, here to tell us a little bit more is Dr. Jessica Zwerling, who is director at Montefiore Hudson Valley Center for Excellence and Alzheimer's Disease. And good to have you.
Thank you. Thank you for having me in the studio.
Good. I remember dealing with a couple of people, and it seemed as though the question was Bell's palsy, stroke. You had that kind of, thought process. Later found out that it was Bell's palsy. Totally, I was totally lost. And I think it was the first time I was introduced to it. But I think for a lot of, New Yorkers and people across, the United States, sometimes people just don't know exactly what Bell's palsy is. So why don't we just have a moment for education purposes and share with people what Bell's palsy is about?
Sure, you bring up a great point. It is part of the differential where we think about stroke and we think about Bell's palsy. It's a weakness of the seventh nerve, which is the facial nerve, which can affect our ability to close our eyes and move our mouth. So it can present like a stroke, and it is one of the warning signs, facial weakness of a stroke, that we try to remind people of. But Bell's palsy is actually not a central phenomenon. It's actually a process that affects our peripheral nerves. It's a common, like what we call mononeuropathy of the facial nerve, and commonly you can have weakness of the facial muscles, which can cause some drooling, some difficulty with speech, which actually can mimic a stroke.
Right. So what exactly causes Bell's palsy?
So there's a couple of theories behind it. It really is inflammation of the nerve, of the seventh nerve as well. There are some theories that it could be from the herpes virus or some of the zoster viruses, but it really is just a main inflammation of the nerve, of the seventh nerve.
So it just occurs, how does it,
It can have some viral etiology, but given the mainstay of treatment is prednisone and treating the swelling, it can be an inflammation of the seventh nerve that can cause that weakness.
And so when you see a person, the question is, there's a little fear and panic there too, right? Because my face is a little contorted, I don't look right. I'm wondering, how long is this gonna last? What's this process gonna be like? So you're the doctor, walk us through.
Right.
How long does it usually last, and what's the process like?
So the process is you can notice some weakness on the side of the face. We'd like to teach people about warning signs of stroke. So if you're with someone and they have difficulty speaking with weakness on one side of the face or weakness on one side of the body or difficulty really articulating, that's actually an emergency or something that could be a pending stroke. As far as Bell's palsy can last. Most people improve. The treatment is really important within the first 72 hours in starting prednisone. And that treatment and that prognosis can be, most people improve over 2 months. People that have a severe weakness to the side of the face can have difficulty over several months, but overall it's a common disease with a good prognosis.
So you go home, you deal with this, and what about home? What are the treatments? Is there anything I'm doing on a daily basis at home, or am I just letting things naturally take its course?
Prednisone is a steroid that can be initiated within the first 72 hours. In addition, some of the side effects are you want to protect the eye. So your eye may not be able to completely close. When we go to sleep, if you have weakness of eye closure, that eye will remain open, which makes you very vulnerable to any kind of cuts or on the cornea itself. So we give lubricant for that as well. So some of the doctors that may be involved, you should see your primary care physician, otolaryngologists or ENTs are commonly see this disease, neurologists, this is a common phenomenon, but something that is easily diagnosed, treated, and with a good prognosis.
So specifically at Montefiore, how do you deal?
We see this commonly in the emergency room. I always say to my residents, if you're seeing it in the emergency room, you can think about a stroke, but no one's going to be faulted for bringing someone in to do more of a workup. Common conditions associated with Bell's palsy can be Lyme disease, can be diabetes. We sometimes see it in the late trimester, in pregnancy. So this is commonly seen in our outpatient offices. This can be really evaluated and treated in our primary care offices as well as our ENTs and our neurologists.
How long does it take to make that diagnosis, right? Because I think, I remember the person was talking about Bell's palsy, stroke. They seemed to be there for a little minute. It took a minute to make that affirmative diagnosis.
Well, weakness of the face can mean a couple of different things. There are rare genetic syndromes that may affect a recurrent Bell's palsy, but in the context of just your garden variety Bell's palsy, you want to make sure there's no hearing involvement as well that may look to possible an acoustic neuroma that can happen at one of the angles of the brain. That would mean that there was a lesion or a tumor that would be in the brain that would need more imaging that wouldn't just affect the peripheral nerve. Other disorders you want to make sure that happens when you have acute facial weakness are things like Guillain-Barré, which can cause acute facial weakness, which have to be monitored. But commonly this disorder is recognized. And one of the funny things about nerves is that we can rejuvenate, and that an injured nerve can branch out. So some of the side effects can mean something called crocodile tears, but you can have excess tearing with chewing, which is a phenomenon that can be burdensome for patients long term, but really not a very common sequelae after Bell's palsy.
And what about genetically? Is it genetic? How genetics play out?
There's a rare syndrome called Malcolmson-Rosenthal syndrome, but this is a disease that happens in our population from ages 15 to middle age, and it's just really being aware of some of the common signs that you brought up yourself about being aware. Is this a stroke or is this related to Bell's palsy? And making that awareness that any change in speech and any change in what someone looks like in their facial expressions is important to recognize and seek treatment.
Someone who seeks treatment, they get through it, they're doing a little bit better. Of course, always that fear of reoccurring, right?
Right.
Is that a possibility, strong possibility? How does that work out?
Very small possibility. Recurrence rates are usually less in the 7% range unless there's a genetic variant, and that genetic variant has associated oral facial swelling, tongue fissuring, and not a very common genetic association. So prognosis is good.
So before we go, please share a little bit about Montefiore and the great work that you're doing, particularly with this.
With Montefiore, we work closely and collaboratively with our otolaryngologists. And in the neuromuscular realm, we may do what's called blink reflexes and look at prognostication for Bell's palsy. There's a lot of things. There's a lot of buzz about acupuncture also in the treatment of Bell's palsy. I'm looking forward to seeing more organized and randomized controlled trials, really doing head-to-head trials on prednisone and acupuncture to see if that's really a great treatment for Bell's palsy.
We'll be looking out for it, but certainly thank you for the awareness. Thank you for the information. Dr. Jessica Zwerling, who's here with us, sharing with us a little bit about Bell's palsy. Thank you so much for coming.
Thank you for having me.
All righty, listen now, for more information, you can visit the website, montefiore.org, Alzheimer's Center, or you can call 914-375-4880. That number, once again, 914-375-4880. It is always better to go ahead and get checked out. Well, listen, stay tuned. We've got more Open coming up, more amazing guests. We'll be right back right after this.